What's up, folks? Coco One Love here, and I'm on the ground, so that must mean I'm doing some mobility work. Yes, this is our third video in our mobility series, and we're talking about the anterior hip. Now, I use the term anterior hip because we're covering a lot of different muscles. The first muscle being, of course, the quadricep. Then we're going to catch a lot of some of the TFL, some of the hip flexors that are crossing through here. Plus, we're catching. A lot of you guys think that the IT band is rollable. It's not really the IT band that we're rolling out. It's the tissues that attach to the IT band. So we'll catch some of that IT band and the tissues that are attached to the IT band. And the area that we're covering is from the hip joint here all the way to the knee. That's what we're going to cover. We're going to cover from the hip joint all the way to the knee. Okay? And now this area is responsible for a lot of things. It's responsible for what we look like when we squat. It's responsible for all of the hip flexion movements. And of course, this gets tight from us just sitting around all day in the car and on the couch at the desk. So let's cover this real quick. We're going to get down here. We're going to start on our side. And you can start from your knee or from your hip. I like starting from my hip. And what we're going to do again is we're going to go cross fiber, because our fibers are supposed to look like this. When they get jumped up, they end up kind of looking like this. And what we want to do, we can't just roll them up and down. That's not going to really affect them. We want to peel them apart. Okay? So here I am. I'm going across fiber, catching my quad, coming back all the way. I'm high on the hip. I don't feel anything's going on there. I'll scoot down an inch and I'll go across fiber. Boom. Do a couple rolls here. Boom, not feeling anything. I'm going to go down a little bit an inch. So on and so forth, all the way down towards the knee, okay? And when I talk about the knee, get on the tissues right above the knee. Get on those tissues because they get very ropey and tight as well. So if we're right here, ooh, I felt something tight. I can sit here and just hang out here and just try to breathe and try to relax. Ooh, that's kind of tight. Ooh, ooh, ooh. Try to relax, try to relax, try to relax. As Kelly Starrett would say, keep your Zen face on. And you're just hanging out, hanging out, hanging out. You could do a contract, relax, where you kind of squeeze that muscle. 5, 4, 3, 2, 1. You let go, and you just fall into it, and you relax, and you feel like it's easy. You can even do ART, active release technique, where you're on that tissue, just hanging out, and you're flexing your knee, and then extending your knee, flexing your knee, extending your knee. And what that does is it basically pins that tight tissue down, and then you're creating elongation through the flexion of the knee, okay? And we're going back and forth all the way to the knee, and then once we cross on the knee, what I like to do is I like to actually roll over onto the quad, and then just kind of roll up and down on that quad. I feel a really tight spot right here, right now, for real. And so what I'm going to do is I'm just going to do that ART again. I'm just going to move through that tight area. And what that does is I pin that ropey tissue down, and then I'm just creating elongation. I'm pulling all those tissues through that spot. Okay? And I just keep on going. Just kind of spending some time through there. All the way up till I get to the top of the hip right here. Okay? And that kind of covered basically all that anterior hip flexors, TFL, and quadricep. Doesn't matter, it just, what really matters is what this is responsible for, and it's responsible for hip flexion. We stay flexed all day long in a seated position, and we need to reverse that effect so that we can get full extension. Okay? And so if we want to retest, we can say, okay, how high does this knee go? Right about here. Okay? And then let's try this bad boy. And right about here. So, whoa! What is that? That might be like 3 inches or so, if you can see. Okay? So that's the anterior hip. Coco, one love. Do good, baby. Work on those tissues. Like us, love us, subscribe. Peace out.